Hello, everyone. Hello, ladies making baby, and Justina. And hello there, Claudia. Nice to see you. Lionessa, welcome back. Kathy Dreams, hello. Scrub Lifinette, okay. Louisiana Rosario, nice to see you. Welcome, folks, on at CNY Fertility. I'm Dr. Magarelli. I'm from the Colorado office. Welcome, Katie. Good to see you. Hey, hey. Looks like we're going to be streaming on both Facebook and Instagram today. Kiss, kiss to everyone. Hello. Hey, Queen Micah. Good to see you. Hi. Rolazi Megan. Good to see you. And Aaron. Good evening. Today we're going to be it's going to be question and answer, but I want to work on medications for a short period of time, kind of talk you through that. Amber Kelly Martin, my dearest daughter, how are you? Good to see you. New place, new background. They're doing some work on my house, so here I am. Hello, Maria Cruz. Good to see you. Natalie, Antoinette. Kristen, hi, Dr. Mag. Cycle day 1 and heading to see you in a few days. Can't wait to see you, Kristen. Latoya, good to see you. Perfect Angel, New York City. I didn't know they had angels in New York City. I thought it was Los Angeles had the angels. Jasmine, good to see you. Melissa, share with you, I'm 16 weeks pregnant. Oh, unbelievable. Oh, God. God bless you. I'm happy for you. Maria, good to see you. So let's see, we're in it about, no, not even a minute yet. So we'll just keep waiting till folks jump on. Sorry about my voice today. It seems to be a little bit tight. We have varnishing going on, so that's probably what it is. Hey, Lindsay, good to see you. Splash of tea. Splash of tea. Queen Brit, 212. I like that. Queen Brit. Lindsay, I've already said hi. Megan, 4 days past France, so what do you advise about swimming? I don't think there's a problem with swimming. You know, don't overexert yourself. But yeah, there should be no issues with that. But again, public pool, the vagina, you know, just not sure. What's Lovenox used for other than clotting disorders? Do you see success when using Lovenox without Neupogen? Well, there are no studies, Amber, and we are going to be talking about medications. So I would love to just answer questions about medications, or I'll talk a little bit about them. But let's all ask things about medicine. So Lovenox, as you're right, it's an anticoagulant. But what it does, the hope is to reduce miscarriages by reducing the microclots that can sometimes form when there's an abruption between the placenta and the mom. So that reduces the chance for those clots to expand, because it's interesting that the uterus has a different mechanism than the rest of the bloodstream, in that if you give a anticoagulant, you tend to keep it from excess bleeding. It's our own private pool. Enjoy yourself, Megan. Hello, Shelly Lynn. Fabiola, hello. Nice to see you. Tanya Salas, good to see you. Romisho, good to see you. Does Mucinex, Lauren, does Mucinex actually help sperm swim in cervical mucus? Do you advise to use it during IUI treatment? Well, the guaifenesin actually is what you were thinking of, Lauren. Guaifenesin is in cough medicines. That's the one that's been studied, so you might want to get that. Get it at Walmart cheap. It's stuck. I don't advise it during IUI treatments, but nor do I condemn it. If it's something you want to try, fine. Not a lot of good data there. Do you see success with that, using Lovenox without Neupogen? Absolutely. Most of the history of anticoagulants are aspirin plus Lovenox or heparin, and that's 25 years at least. Neupogen, fairly new, not a lot of information. So yeah, please, with a lot of the medications in the level 1, 2, 3, and 4, they are not mandatory medicines. They're medicines designed, that Dr. Akils designed around the concept of inflammation and autoimmune disorders, but they're not required. Can you tell us about Menopur? Okay. This is Emma. Well, Menopur is a combination of FSH and LH, follicle stimulating hormone, and luteinizing hormone. So Menopur is unique in that it has both FSH and LH in the form of HCG. Gonal-F and Follistim are strictly FSH, follicle stimulating hormone. Now, why do we use it? Well, in an IVF cycle, we're trying to save eggs. Most folks think we're trying to take eggs. So hold off on your questions for just a second so I don't lose them, because I'm going to talk about this for just a second. So we use the medication to save eggs. Why is that? In a natural cycle, the body only has enough FSH produced in the pituitary gland to feed 1 or 2 follicles to grow 1 or 2 eggs to ovulate. So the rest, which is anywhere from 999 to 9,999 eggs, get lost or thrown away or recycled in the body because there's no food to feed them. So the medication, Follistim, Gonal-F, Menopur, provide follicle stimulating hormone so that the follicles have food so they can grow and mature. So essentially what you end up with, not just 1 egg, but multiple eggs. Now, what's the difference between Follistim and Menopur is that, or Gonal-F and Menopur, is that Menopur is from natural sources. Urine, actually, is from the urine of menopausal woman. That's hence Menopur, purified menopausal urine. And Follistim and Gonal-F are recombinant. They're designer drugs. The hamster CHO cells, they do gene insertion and they start producing human FSH and human LH, these cells. And so what has been learned over time is that the body actually needs a combination of FSH and LH to make a good egg to develop. So we usually call them mixed protocols. So mixed protocol is something where you provide the recombinant FSH because it's less expensive than the urinary form. And then you add the urinary form to add some LH. Well, what's another way to add LH actually is by adding HCG. So a lot of you are on cycles that are 200 of Gonal-F, 20 of LH, HCG, LH, 200 of Gonal-F, 20 HCG, LH. And that's just us making up our own Menopur. So I hope that answers your question. What is the best for elevated NK cells? That's not my area. Sorry, I don't know. The pregnancy and oil has been leaving knots on me in the morning after doing them. They're so bad I can barely move, hurts to move. Is this normal? Amber, it's normal if it hurts, but it's not normal if it's red. So she's PIO is present progesterone in oil. So progesterone in oil progesterone in oil is probably the best form of progesterone to support IVF pregnancies. And so it's oil. Oil in muscle hurts and takes a long time to dissolve. So that's what the knot is. Now, if it's red, scaly, hot, stop it immediately. Stop it immediately. Call your nurse team, the on-call nurse team, and get a substitution like vaginal progesterone or even oral progesterone. Okay. Shelley. Are the medications and vitamin treatments for IVF done the same as for someone who's had bariatric surgery? Absolutely. You will always get from different nurses each time. Yeah, by the way, I had this happen today. I was told that someone said, a nurse said, that a nurse said, and a nurse said, and someone in Syracuse said, and I'm in Colorado, and someone said, we are a big organization, over 400 employees. And we have nurses, professional licensed nurses, probably 100 of them. And they're in many, and they're fantastic. And some of them are on the phone, some of them are in person. They're going to have opinions. You have 14 or 15, now 16 providers. They're professionals, licensed. They're going to have different opinions. There is no right answer when it comes to fertility treatments, because as I've said before, fertility treatments are based on observation, not really on science, because we are not allowed to experiment on pregnant women. We're not allowed to experiment on embryos. We're not allowed to experiment on putting embryos in pregnant women. We're not allowed to do the experiments, so all we could do is infer, like inference, as to what we see, and maybe this is help. So Jamie, when do you take baby aspirin? Well, the main goal for baby, and how long? The main goal for taking baby aspirin is like Lovenox. It's to create a slight thinning, we'll call it, or anticoagulant effect in the blood. And we would like to take you to take that during the transfer cycle up to about 20 weeks gestation. So what, 20 weeks pregnant, okay? You could take it up to that long. Okay, all righty. Melissa, I tried HCG for the first time, lost all embryos day 6, only one made it to, I'm not sure what that means, sorry. If I want to, cannot produce an egg, if I cannot produce an egg, what would you recommend? Donor egg. You can use donor egg. If you're unable to produce eggs on your own, you can use donor eggs, and then we can get your uterus prepared for the embryo. Again, I'm trying to focus on medication questions just because I like to have a topic here. But since there's no medication, okay. Started taking Omnitrope. Does it really improve my chances? So what is Omnitrope? Omnitrope is growth hormone. It is the only well-studied add-on in IVF that has been shown to improve IVF outcomes in patients with low ovarian reserve. And recently, a paper suggested that it can be used also to help people with somewhat normal ovarian reserve. So how it works is growth hormone is an intra-ovarian regulator. It's used in the ovary. It helps with the growth of everything from bones, muscle, eyeballs, but also to the growth of the follicle. And as we age, of course, we have less growth hormones, so therefore we see a diminution or a decline in our fertility and rankling and all that other stuff. So what this does, and also what the Omnitrope is, are injections of this medicine, which allows, which is a hormone, which allows to replenish the body's growth hormone. Serovital is a growth hormone secretagogue. What it does, Serovital is a, well, there you go. Is there another drug besides Omnitrope or Serovital that I can take? I'm not sure why you would want to, Tasha. But Serovital is a growth hormone secretagogue, and it's a group of molecules that stimulate your own body's production of growth hormone. Dr. Kills recommends progesterone and estrogen over birth control pills. Oh, Melissa, so how is it beneficial? Well, birth control pills are actually chemicals. They are not like estrogen and progesterone. They're simply estrogenic and progestogenic compounds that have their own chemical properties. I prefer estrase, progesterone, like Dr. Kills, because it's a more natural form of, it is the natural form of the hormone that your body uses and needs, and you can control it much more so than a birth control pill. Do you prefer estrogen or progesterone to thicken the uterine lining? You cannot be Noble Jack. You cannot thicken the lining of the uterus with progesterone ever. You cannot thicken the lining of the uterus with progesterone ever. Progesterone consolidates and tightens the uterine lining. It does not grow it. The only compound we know, or that's readily commercially available to grow the lining, is estrogen. Estrase, estradiol valerate, which is injections, is by far the best. But there's many forms. There's vaginal estrogen, there's oral estrogen, there's patches. Okay. Tasha, I'm allergic to Omnitrope. Well, there's a Seraphin, which is another form of growth hormone. But you, so that would be, see if you can get another brand and see if you're allergic to that, because it's usually the carrier. And then, are you allergic, Tasha, to Serovital? I would find that hard to believe. Is there a medication I can take to get rid of a cyst on my ovary if I can't take birth control? Yes, estrogen plus progesterone. What's Lovenox Neupogen? That's two drugs. Those are two different drugs, Lindsay. One's Lovenox, one's Neupogen. One's used as a for the inflammation and and auto antibodies, and autoimmune, and then the other one is a anticoagulant to reduce clotting. What medications helps you with low AMH? Well, Catitate. No, there is no medicine to help you with low AMH. There is a medicine to help you get your ovaries to respond, and that's gonadotropins, follicle-stimulating hormone, luteinizing hormone, Menopur. Those are the things that you want: Menopur, Follistim, and the Gonal-F. When do you start the Claritin and Pepsi protocol? Well, honestly, that's probably a good nurse question. It has to do, so I'm not that sure about when they do that, and I don't have any thoughts on Plaquenil, Ardale Shepherd, because honestly, there's not a lot of data. Don't have a lot of data on it. It's a theoretical contribution to, we hope, to implantation, but there's not a lot of data on it, and I tend not to prescribe things I don't have a lot of information on. It's not right or wrong, it's just I don't. What medication helps with elevated NK cells? Again, Jack, don't know. Doc, I'm seeing estrase, endometrium, and prometrium on my med list. What do I use when? Okay, so estrase, endometrium, and prometrium, those are all for your transfer. Is there a medication to use in place of letrozole? Now, letrozole helps you ovulate, so does Clomid. So clomiphene citrate, letrozole. How do you decide who would be a good candidate for low-dose HCG or Menopur? That would be someone with low ovarian reserve, very poor reproductive outcome, and it's basically to save money. What medication do you take on the endo protocol? Not sure, CAR 1513, what that means. Taking progesterone and estrase for 24 days prevented ovulation, so I was left with a 30-millimeter cyst. How to get rid of it? Unfortunately, Judith Glant, it's just time. What is the benefit of an HCG wash? Now, what is an HCG wash? Now, HCG is a hormone, the pregnancy hormone, which we wash or bathe the inside of the uterine lining with the thought that we upregulate the receptors for the implantation of the embryo. So you do it before the embryo transfer with the thought that you're upregulating, meaning turning the receptors on that says, hey, 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 time to get pregnant. Hey, 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 time to get pregnant. Hey, Jamie Stewart Mendez, just started my letrozole today. Good for you. Hey, Kim, when should you start taking progesterone through a fresh transfer? Oh my gosh, Kimberly, you should absolutely need to get a calendar, and it tells you exactly what to do. And I mean, I could easily tell you, but oh my God, you need to talk to the nurses. If you don't know when to start your progesterone, they're not doing their job, or you didn't understand it, or you just didn't read it. But you need to know, and you need to have that timed perfectly, which is 6.5 days before the transfer. I used to have high DHEAS and testosterone, spironolactone, lactone, lowered all of that. Why can't I get pregnant? All my hormones are normal. Sugars impaired. Well, Haley, sperm, eggs, uterus, fallopian tubes, thyroid, prolactin, polyps, fibroids, infection, scarring, blocked tubes, poor sperm parameters. There's a list of 1 million reasons why you may not be getting pregnant. If I don't have Ovidril on my list, but there's Lupron, would I trigger with this? Yes, you trigger with Lupron. Absolutely. So what are the triggers? What do we mean by triggers? Well, when the follicle grows to a certain size, you use a medication to do the last step of maturation of the follicle, or the oocyte in the follicle, and then you also use it to break the stalk that's holding on to the egg inside the follicle, so it'll float inside the fluid, so that it allows us to suck the egg out. So you could do it 2 ways. If you're doing an antagonist cycle, which is with citrotide, then you can use a Lupron trigger, or you can use an HCG or Ovidril pregnal trigger. So you can use one, both. You could use it once, twice, and it's going to be depending on your doctor's orders. What is the rationale for metformin increased to 3 times a day from once a day after a failed fresh transfer? Well, Nabitaki, the therapeutic dose of metformin is 3 times a day, not once a day. You do it once a day until you feel like you can tolerate it, then twice a day, then 3 times a day. That's considered the therapeutic dose. Now, you could do less. Some people even do more, but the reasoning is to get you to therapeutic dose. What is the reasoning behind it? What is it? I don't know what it is. Should aspirin be taken at the same time during the day as Lovenox? Doesn't matter. Are there good alternatives to molecular? Yes, oh my God, Cage Spurred Nikki. Theralogics, anything that's been registered as a prenatal vitamin. Actually, Walgreens prenatal vitamins have the higher level one, which is very inexpensive. For men, there's a GNC Mega Man vitamins. Yes, absolutely. Our goal in providing molecular fertility vitamins was to try to get you sort of a one-stop shop. But if you talk to your acupuncturist, they tend to have a brand that they like for vitamins. So, yes, you can use different kinds. After my baseline, when I start medications, what is the general sequence of medication for a standard protocol? It's basically you're going to be, well, actually, I should say there's 2 major ones. It's either a gonadotropin, which is follistimular for Menopur, or HCG-LH, and you're going to be taking them every day. And those will get adjusted based on your response. Kimberly Pelosi, pros and cons of an HCG wash. Well, there are no cons to an HCG wash except cost. The pros is the hope, and again, I'm using the words hope. I'm not saying studies, I'm not saying data, I'm saying hope that by providing these add-on type of medications that we can somewhat enhance implantation in few people. Okay, your retrieval is Thursday. I will be doing your retrieval Thursday. Sonam Chutan. Yes. Had 2 retrievals and a failed transfer. This is Jessica. Have another transfer coming up. All they have me on is progesterone and estrogen. They are the #1 critical things to be on. You could be on low-dose aspirin, prenatal vitamins, estrogen, progesterone, acupuncture, sometimes Serovital. You could be on Serovital, which is a growth hormone secretagogue. Yeah, those are the main ones. And depending on what your history is, you might be on level 1, 2, 3, or 4 of our immune protocol and our antihistamine protocol. So make sure you contact the team and make sure they have you on that medicine. What medication do you take prior to frozen embryo transfer with endometriosis? The exact same as everyone else care, which is estrogen and progesterone. Those are the key. Pros and cons, pros of using Viagra, Kimberly. Well, there are some studies that suggest, not proven and certainly not conclusive, that adding Viagra may increase the uterine blood flow, which may increase the thickness of the lining, which may increase your chance for implantation. So there's a lot of mays in that. When is a recurrent pregnancy panel ordered, done, or does the medication help avoid bacteria like Z-Pak does? Don't understand the question, Jasmine. Kavita, omnitrope dose for prime and stimulation is 6 international units. Which has higher success rate, fresh versus frozen? Neither. What's the success rate of transferring a day 6 and a day 6? Our transfer is Thursday. It has nothing to do with the grade, Amber. IUI letrozole 10 milligram with trigger. When would you recommend timed intercourse? After you ovulate. So you do the trigger, and then you could do it that evening. You could have intercourse, and the next day, and the next day. What is the benefits of low dose naltrexone? It sort of modulates the inflammatory and immune response somewhat. It's really, there are, for some reason, opioid receptors that, when upregulated, tend to have a negative effect on implantation. So this kind of downregulates those receptors. Do you prescribe Recovil? I don't know what Recovil is, Silvana. Tell me what Recovil is used for. IUI with letrozole. Okay, looking like we're losing here. Let's see. Okay. Once you have a confirmed beta, are you tapered off prednisone? Yes. Yes. What is Serovital for? Serovital. Serovital. Serovital is a growth hormone secretagogue. And what that means is it stimulates your body to produce its own extra growth hormone. Kavita can't ask any questions about NK cells. That's really more Dr. Kiltz's area, and I think he has a talk on Sundays, actually. Do you recommend the microdose flare for protocol? Yes, of course. That is for saving money in those folks who have very low ovarian reserve. It saves you money on medications. Doesn't do anything else. Recovil is used for egg stimulation. Sorry, don't know what it is. Do you recommend, too many questions. Will the nurses, doctor, tell us, Katie? No, I'm telling you that anyone can take Serovital. It's not a medication. You get it at Costco. It's very inexpensive. You can use it for your skin. You can use it for your bones. You can use it for your, but in this case, we use it to just improve, your own body's growth hormone. Does length of taking Orilissa affects its benefits? Good, Sean. Amazing. Well, we'd like you to take the Orilissa for 3 months, because most of our studies say 3 months, that by suppressing endometriosis for 3 months, you tend to see the best effect without the longest time. Typically, how long do you take progesterone and oil shots after transfer? 12 weeks or 8 to 10 weeks. 8 to 10 weeks, usually. All righty. What does metformin do as priming? It is not a priming agent. It's used for PCOS patients. Do you prescribe medication for male factor? What is the first steps we should take, Silvana? Well, I would take, the first step is testing the egg, sperm, uterus, fallopian tubes, avoiding alcohol, tobacco, and drugs, especially the male and the female both. Vitamins, certainly, CoQ10, folic acid, vitamin D3. By the way, folks, everybody should be on vitamin D3. Every patient I've ever tested was deficient, so please make sure you're taking vitamin D3. It's good for fertility, it's good for life. CoQ10, everybody can take that. Folic acid, men and women, not just women. Avoiding smoking or anybody who smokes, marijuana or anybody who does marijuana. These things affect the sperm remarkably, as well as the egg. Kathleen, call East Winds Acupuncture, 719-520-5056. Talk to Dr. Credenda about the acupuncture protocol. It's published everywhere. It's called the CMAP protocol, or go to eastwindsacupuncture.com, Dr. Credenda, Cridennda, and she'll be happy to help your acupuncturist, especially if your acupuncturist call. Should Serovital be taken throughout the pregnancy? I see no reason not to. It's really 3 critical amino acids, so there should be no problems there, but not studied, so I can't tell you for sure. How much vitamin D3 and CoQ10? Look up on our website on our family building guide, at least 2,000 units of vitamin D3. I take an average of 5,000 units a day. And okay, with Hashimoto's, should we increase levothyroxine prior to IVF? No, you just monitor your levels, T4 and T3 and TSH, and that's what you use to adjust it. Are there needle-free options for medications? No. Caged bird. With confirmed endo on my ovary and diminished ovarian reserve, do you recommend removing the endo with excision surgery? Surgery is important, but Jenna, so is time. And you may want to do this. I always recommend the following. I know it's not medicine, but get your eggs out, make your embryos, then do the surgery, because your uterus does not age, but your ovaries do, and the eggs die. So get your eggs out, make your embryos, freeze your embryos, then consider whatever you're going to consider, like surgery. Okay? What's the medication protocol to prep someone who's had an ablation over 10 years ago? None. If it's a true ablation, your inside of your uterus should not respond to medication. Now, if it's an incomplete ablation, this is where you scar the inside of the uterus to keep it from bleeding, and then estrogen would be your prime, then progesterone. Jen, are there recommended amounts of the D3 in most prenatals? No, there's only 400 units in a prenatal, and I'm saying 5,000 is probably something reasonable, 2,000 certainly, and then you could always get your vitamin D3 levels and prove it to you. The life of two moms. Okay, my progesterone was low for FET. Can that stop implantation from happening? Yes. I had to cancel an IUI due to my estrogen levels being too high. Yeah, ovarian hyperstimulation. From being prescribed oral estrogen from a previous cycle. That doesn't happen unless you took it during the current cycle. Canceling a cycle due to high estrogen is usually a response thing, not simply this is an IUI cycle. I don't know why they're measuring estrogen. Can a former C-section scar obstruct implantation? Yes. What is the benefit of intralipids? Well, think of it as a fast way to be on the keto diet, in a way. It lowers inflammation. So, but really the best way is to lower your carbohydrate consumption. Look at Kiltz's Keto, look at Low Carb Down Under, look at the Diet Doctor. All of these are oriented towards low carbs, moderate protein, high fat diet. So intralipids is getting that high fat in there to reduce inflammation, because believe it or not, fats are your friend. They really are. Righty. Good. All right. And why would someone request to be in my live video? I don't understand that. The answer is no. Okay. So what are the medications? A lot of times you'll be on things like antibiotics, Z-Pak. And why? Because there are 2 organisms or 3 organisms that can reduce implantation in a fresh cycle: Mycoplasma, Ureaplasma, and Listeria. And these organisms get cured with a doxycycline or zithromax. So that's why you're on that medication. I just ordered all my meds for my next cycle. I decided to wait an extra month, so I'll start next month. Should I continue taking LDN? One life live? Yes. Does letrozole suppress the E2 level during IVF, Nanu? Yes. So it'll trick you, letrozole, into believing you may not have ovarian hyperstimulation, so be very careful. 32-year-old, left endometrioma, 9 centimeters. Get that excised. During my second harvest, trying to decide whether to do a frozen transfer after the next harvest or do surgery. Take care of the endometriosis, please. What is Leuprolide used for? Leuprolide is used to keep you from ovulating. That's all it is. That's all Lupron does, or Leuprolide does, is keep you from prematurely ovulating. It can also be used as a trigger if you're using Cetrotide or Ganirelix, because it has a paradoxical effect on the body. But most times you're using Lupron to prevent the person from prematurely ovulating or to help trigger the ovulation. Have you had any noticeable abnormalities after transfer of low mosaic embryos? By me, you mean our field of reproductive medicine, because very few people transfer low-level mosaics. However, most likely the thing that's going to happen is not getting pregnant or getting pregnant and miscarrying. That's pretty typical of what happens when you do a high or low-level mosaic. So thankfully, the embryo is an all or nothing organ, in a sense, group of cells, meaning it either survives or it doesn't. It's either it's normal or it's not. So luckily, we have yet to see, but I'm sure it's going to happen, where there are going to be babies who have deformities or chromosomal abnormalities or problems with their life from transferring mosaic embryos. What is my opinion on expired medications? Don't use them. Would a woman who is 45 need more medicine because we are older? Yes. What is the function of prednisone? That's to reduce inflammation. There are alternatives. How long after a salpingectomy should wait until starting an IVF cycle? 6 weeks. How many days prior to transfer is HCG wash and intralipid infusions done? Day before, 2 days before, depends on how many times you're doing it, but it's usually at least a day or two before. If your prolactin levels remain elevated, no tumor, can you proceed with the retrieval, or will you need medication to try to bring the level down? Yes, use medication to bring your levels down. Periods are normal and I don't have symptoms associated with high prolactin levels. Yes, bring your all your hormones should be brought into harmony or to normal prior to IVF, with the thought being that the body is an intricate system and you don't want anything out. Oh, so good. 03. Hi, Dr. Mag. LAP versus Receptiva test. Do I need either? Not transferred yet. Well, do you have a history of endometriosis? Folks with a history of endometriosis or symptoms, really, really super painful periods sometimes associated, intermenstrual period bleeding, pain with intercourse, all of these abdominal pain throughout the menstrual cycle. All of these may signify endometriosis, which we strongly recommend people get treatment for. Why is birth control pills used prior to IVF? Golden 1XO. The main reason we use any hormone is to control the cycle so things fit on a calendar. That's 99% of the reason. What does the estrogen level need to be 5 days after transfer? None. There's no level that it needs to be. You just have to take the medicine. It's really, levels have really nothing to do with any of this, as long as you're taking the medicines, especially the progesterone. That's the critical one. I have PCOS. Besides taking medicine, what would you recommend to get me ready for my first IUI? Is acupuncture, myo-inositol, a low-carb diet, keto diet. Kills keto is an option. Avoiding carbohydrates of all sorts. That's what I would recommend. How is endometriosis diagnosed, Ash Jawalt? Well, the classical way to do it is with surgery. Some folks are now doing what's called a prognostic test called Receptiva, and that's just a biopsy of the uterus. How many days prior to the transfer does the HCG wash? I thought I just answered that, Sonam Machutin. It's at least 1 or 2 days before, and it depends on how many times you're doing it. You're welcome. Christy with OHSS, is it possible to do an FET? No. Oh, the next cycle, or is it recommended to wait another cycle? Is it possible to do an FET with the very next cycle? Yes, it's possible, but again, you really want to get back to normal, and if you've had a normal period and like you said, your hormones are normal, then you can. PCOS question. If Yaling metformin is myoanastomosis still beneficial? Yaling. Zolorana. If taking. Got it. Thank you. That was Yaling. That was a good one. Yes, absolutely. The mechanism by which metformin works as a glucophage and the mechanism by which myoinositol works, which is a nutraceutical, very different, but both control sugar. Sugar is the killer. Sugar is the killer. Does aspirin help implantation for women with endometriosis, Jesse? Has nothing to do with endometriosis. So aspirin helps implantation regardless of endometriosis. So that's the best answer for that. Okay. You're welcome, Haley and Jamie. You're welcome, Jesse. Everybody's thanking me. Oh, I got 5 fair, oops, missed that one. I got 5 fair poor grade blasts last round. Should I expect the same results this round? No protocol changes. Well, every single cycle has its own potential. So guys, I keep being asked, is my embryo good? The answer is it your embryo? Yes, it's good. That's it. Is my embryo good? It's your embryo. It's good. You can get another embryo, and it may have a different grade, which may or may not be better, but it's not your embryo. So if it's your embryo and it's alive and it's transferable, it is good. Oh, B Noble Jack, my pleasure. What is Humira and Serovital used for? Well, the Serovital is a growth hormone secretagogue. We sort of talked about that. Improves growth hormone. And for the life of me, I can't think of the generic name for Humira. You'll have to give me the generic name. Pregnol was prescribed last cycle, but was never instructed to use it. What is it used for? Well, Nabitaka asked the nurse, but usually it's used to trigger, but sometimes when your estrogen is too high, it doesn't. And you could always, folks, if you have HCG, always, and you didn't use it, ask to use it for an HCG wash, ask to use it for HCG boosters. So use it. And then folks, just so you know, we always order all your medications up front. We assume you're going to get a transfer. We do not order the medications piecemeal. It never works out. Everyone forgets, and it's a problem. I know some of you won't get transfers, and you're going to say, oh my God, I wasted my money on the medications, but that's the system, is we order everything up front, so you have everything, because again, you never know when you're going to need it, and then you can't get it emergently. Would you do an HCG wash if you were doing an FET, Katie? Yeah, absolutely. Gina, 25. I was just told I have a polyp and a slightly thick endometrial lining. Could this cause infertility? Yes. You need surgery. It's called hysteroscopy, operative hysteroscopy. Should we take metformin for weight loss for help with keto? Well, you never take a medicine for weight loss, because there's no medicines out there that are for weight loss. You may lose weight on metformin, but it's only because you're lowering your carbohydrates in your bloodstream. Keto automatically lowers the carbohydrates in your bloodstream. Is oh so good. Oh, so good. Oh, yeah, lots of questions. Very colorful picture. Is embryo glue included with all transfers? Oh, my pleasure. Yes. Embryo glue is a carbohydrate moiety. Don't know if it works, but we don't think it hurts. Some people say it helps, so we've added it to our protocols. It's gotten good press, but not a lot of good data. You mentioned HCG as a booster. When in the cycle could that be used? After the transfer. After the transfer. It boosts progesterone production by your own body. The plug yuck. Doctors told me my eggs. Don't know. Since both Lupron and HCG can be used for a trigger, but Lupron reduces the risk of OHSS, what are the benefits of an HCG trigger that lead to HCG being the default? Well, most of our history is on an HCG trigger, to be honest with you. History meaning 40 years, so not a long time for IVF. Maybe it's a little more than 40 now. Absolutely, you don't need an HCG. You can do a Lupron trigger. It's definitely recommended for donors. I strongly recommend it for everyone to do a Lupron trigger. But some folks don't get a lot of mature eggs, or don't get a lot of eggs. So sometimes we use a double trigger to help those folks improve their numbers of eggs. But those are the advanced maternal age, low ovarian reserve, poor responders. Probably everybody would not be benefited. And you're right, there is a risk of ovarian hyperstimulation. So got to think about that. Does eliminating or lessening the amount of gluten intake recommended? Yes, EC colon. Want drop? Yeah. Do you have to use oral to treat endo? No, you don't have to. You don't have to do anything, actually. If my thyroid peroxidase antibodies are 14 but TSH is normal, well, that's called Hashimoto's thyroiditis. So you should be on medication if you're trying to get fertile. How long before time to conception? Should my husband stop smoking medical marijuana? Years. In other words, it takes, 3 months. 3 months. You need 3 months of washout is probably a reasonable amount. Bruce and Heather, my AMH is 7. Last year was 2.0, and I'm 34. How did it go up? It did not. Bruce and Heather, all it is was a different laboratory. AMH is not very good between labs. Interlab, it's good, the same lab, but if it's a different lab, their levels are all over the place, and that's one of the problems. Cabergoline, it's used to influence dopamine, which is a problem in the brain, which can affect hyperprolactinemia. Now, in ovarian hyperstimulation, it's been found that cabergoline can also help mitigate the symptoms and signs of ovarian hyperstimulation. So it's just a medicine that helps. I'm not 100% sure why. Lenore, I just had a failed cycle. It is not my embryo. Should I look into autoimmune protocol? I am 45 years old. Absolutely, Lenore. It was the same lab. Can't tell you why, Bruce. I'd call Heather, call the laboratory up. It doesn't make sense. We lose 1,000 eggs a month. It never goes up. It could be wrong. It could be distribution, but no lab is perfect. Jamie, you might be, I've mentioned this, just wondering where do you recommend on going for acupuncture? So the American Board of Oriental Reproductive Medicine, so ABORM.org, ABORM.org. This is an organization that's dedicated itself towards helping folks with IVF and their treatments and fertility treatments get pregnant and hold on to the pregnancy. So the American Board of Oriental Reproductive Medicine.org. East Winds Acupuncture is the local program we use here in Colorado Springs. The Healing Arts Centers in the CNY Fertility family up in Syracuse and in Albany. Yes. Are there any meds men need to start before starting IVF? I keep getting the same question. Interesting. Not medications, but vitamins. Vitamin D, CoQ10, and avoiding alcohol, tobacco, and drugs. Have you had IVF success with women who have a thyroid nodule? Of course. CNY has amazing acupuncture at the Healing Arts Center. Absolutely. Okay. All right, lots of great questions on drugs. You're very welcome, Shelley Lynn. It's my pleasure. This is always fun. I learn a lot. I really do appreciate your questions. It helps us a lot. Got a shout out again to the amazing team at CNY Colorado, the amazing support folks at the Global CNY Global Travel, financial group, the donor group, the oh my gosh, the laboratory people, the embryologists, the andrologists, the endocrinology, folk lab techs, front desk people talk. Listen, we are not perfect, but I'll tell you what, I love working with this team. Dr. Kiltz has built an amazing team of people, and every place he goes, he creates this family, and very glad to be working here. If a patient has low AMH, what meds do you like to use or increase to get more eggs? Of course, there's gonadotropins, FSH, LH, Gonalef, Follistim, Menopur, but also growth hormone and acupuncture. Thank you, Christy. Appreciate it. I'll tell my team. And by the way, folks, if you had a positive experience, you know how the internet works. Only the negatives tend to get online. Send us some positive, send us some love on Facebook, send us some love on all those social media areas. You know, if you didn't have a good experience, call us. We'll fix it. I mean, we will. You know, try not to spew negativity, but if you have positive remarks or a particular staff member took care of you, or you just felt like you really appreciated it, please get on Google, get on Facebook, go to the various websites. It just helps us. Age 26 at PCOS, had a few failed cycles of letrozole. Suggestion on next steps, husband has a very healthy semen analysis. Well, you've had a few cycles. Let's say you had 3, you might suggest to do IVF. How often do you recommend getting acupuncture? Acupuncture is a protocol, and there are 9 treatments before the retrieval and 7 treatments before the transfer. So there's a protocol. Some acupuncturists do it differently, but the protocol is what Dr. Credenda and myself published now probably, gosh, how many years ago? 2000, that would be 20 years ago, and it's used around the world. Ganirelix and citrotide, are they equal, or does citrotide have a better result? Great question. Both of these are used to keep you from ovulating, so they both work equally well. So you can use either. There's no one that's over the other, because all it's doing is no magic. It simply stops you from ovulating. So the critical thing is to make sure you take it every day, because if you don't take it, you will accidentally ovulate and lose the whole cycle and prematurely ovulate. That is such a disaster. So make sure if you take any medication, you take Ganirelix, citrotide. After a surgery to remove fibroids, how long should I wait to look for babies? Depending on where you're looking. That's a joke. It's about 8 weeks. Low dose HCG LH versus Menopur, which is better? They're the same. I'm on a low dose 2 cycles in this upcoming one. They're the same. Can you continue metformin during IVF injections? Absolutely. Can you take Serovital with Omnitrope? Yes, absolutely. Always take the original form of Serovital. Do not buy the expensive advanced form. It's got drugs in it. Take the original form, please. Just people, yeah, take the basic Serovital and get it on sale, man. Get it on sale at Costco. I think it's sometimes you can get a 40-day supply for like $66, which is really cheap. By the way, I take it. That's how I keep my beautiful face, right? What are optimum vitamin D levels for fertility? Above 30, minimum above 30. 60 is a nice number. Most people have a number like 6 or 18. So 30 minimum, but 60 really good, even 70. How early do you have to start the acupuncture for the retrieval? Yesterday, Katie. Yesterday. Yesterday. The more treatment, the better. Yesterday. So as soon as you can get in, and depending on where you live, go to the American Board of Oriental Reproductive Medicine website, or if you live near the Healing Arts Center, call up the Healing Arts Center. If you don't know where to find somebody, call East Winds Acupuncture, or you can email them, info@eastwindsacupuncture.com. Oh, so good. Anytime you take nutraceuticals, they help immediately. So when do you start them? Yesterday. But if you have to start them today, that's fine. If it's 3 months before the retrieval, great. If it's 3 days, great. The idea then, yeah. Jennifer Chang, you must be thinking of Avasitol. Yeah, Avasitol, myoinositol, inositol. Yeah, those are all products in the B vitamin class that influence glucose levels in the body. For a luteal phase of 10 days, would you recommend taking progesterone 3 days after ovulation every month until a negative test? That's a great question. I would recommend you take it up until the pregnancy test. I would take it 2 days after you ovulate until the pregnancy test. Does it hurt to do so each month? No. To do progesterone? No. But after 6 months of negatives, definitely move on. Can you take an inositol with taking metformin? Yes, but be careful. What meds can I take prior to transfer to help with my lining? Estrogen, acupuncture, growth hormones, Serovital. Those are the main ones. Yeah, those are the main ones. What meds can reduce recurring pregnancy loss? Usually it depends on the cause. If it's hormones, fix the hormones. If it's mechanical, fix the mechanical. If it's an immune problem, take anti-immune medicines. And if you look at go to our website, download our family building guide, and look up immune level protocols 1, 2, 3, and 4. And man, oh man, if you're looking for medications, there's a heck of a list there, and that happens to be Dr. Kils's forte. He really likes that stuff. What are my thoughts on the endometrial receptivity assay? They're useful. They are useful, but not everybody needs to do them. Do lipids and PRP wash increase lining? Yes, the PRP wash can increase the lining of the uterus. The intralipids do not. They just reduce inflammation. So PRP is platelet-rich plasma. It's your own. And it has been shown to thicken the uterine lining. It's also been shown to rejuvenate the ovary. So it's a different mechanism. How do I know which acupuncture is good for fertility? It's very easy. Go to see if they're board certified fellows of the American Board of Oriental Reproductive Medicine. So go to aborm.org, American Board of Oriental Reproductive Medicine.org. What meds can, okay, we're answering each other's questions. Okay. Oh, how many times you do acupuncture? There's a protocol. Follow the protocol. You can do it up to 3 or 4 times a week, but hopefully you'll have a 3-month preparatory window. How long Omnitrope to start working? The day you take it. Tips on preparing HSG and saline ultrasound. I've heard they're painful. Yes. So take some ibuprofen before you go. Have an empty stomach. Maybe that's the best thing. Okay. All right, we're winding down here, folks. I think we got a minute or two. Next week, I'm not sure what I'm going to talk about next week. It's been really hard with the holiday and everything else, and we just are growing like gangbusters. But let me just kind of have a general reminder to everyone. Please use our online portal for your questions, specifically to staff members. We get about 8,000 phone calls a day, so it's much better on the portal. It's documented. Please understand that we're not trying to keep you waiting, but a lot of times we do keep you waiting. Thank you, oh so good. Thank you all. But the reason you're waiting is someone's asking questions, or there's an urgent matter, but we time everything appropriately, 15 minutes for ultrasounds and blood work, and 45 minutes for retrievals, and half an hour for transfers. But sometimes problems happen, so yeah, you'll wait. Always ask at the front desk and tell them what treatments you're doing, and say, can I empty my bladder or not? Because if you're doing a transfer, you do not want to pee before you come for the transfer. It delays by hours sometimes, and you don't want to get catheterized. Consents, guys. Consents. Make sure you have the consents 2 to 3 to 4 weeks done before the retrievals or transfers or anything. and make sure that when you get on the phone, you know what you want, and if you don't know what you want, be open to suggestions, but have a clear plan. Talk to your partners. Anyway, I guess it's time for me to go here. Thank you for sharing your time with me as usual. I really enjoyed it today, a little bit different today. I just decided to do the medications, but God, you had great questions. Definitely download our family building guide. Definitely go to our website. The resource page is amazing, amazing about treatments, protocols, everything. So thank you. Have a great evening. And I really look forward to seeing you all in Colorado or wherever you are. So thanks, guys. Take care. And let's see where we are here.